So I'm just going to go back because I'm not sure because of I've been not live streaming too much lately. So I just want to say, first and foremost, I want to start out today's stream with a lot of gratitude. So thank you so much to those of you that have been here, subscribed, following, hitting that like button, submitting questions, because I have like 4 pages of questions that I've gotten over the past couple of weeks. So thank you guys so much. I'm just incredibly grateful for all of the support I've gotten as I've been building the channel over the past years. It is just phenomenal, and I definitely want to shout out a few people in particular. So Tony L. Holmes, if you haven't seen her on Alpha Coding Experts podcast, definitely check that out. Elizabeth Burke, Deb Sterner for her continual support, Brian Cooey, if you haven't seen the Not Elsewhere Classified podcast, that is definitely one you want to check out as well. So now Patel, Marissa McClure, good luck today on your CPB exam. She has been phenomenal with helping support me and the channel. Ian Mattis, Seno Jose, I saw that you were in here a little bit earlier as well. Hi, Seno. Teresa Gallagher, Storm Calhoun from Billion Coding Advantage Magazine. I love them for CEUs. They're so amazing. All my friends on the AAPCCA Board of Directors, all the AAPC chapters that have invited me to speak over the past few years, just thank you. So I'm incredibly grateful for the opportunity to still connect with all of you virtually. So to those of you in the chat, hi Seno, hi Aimster, MLA71, Gina, thank you guys so much for coming in today and being with me on the live stream. So, it's just something that I'm really enjoying, especially these live events, and I will be doing a lot more social media stuff and a lot more AMAs and things like this coming in 2021. For those of you who have not yet heard the announcement, because I don't think I said anything yet on YouTube, but I am going to be moving my business Contempo Coding full-time in 2021, and that doesn't mean that I'm giving up on being a billing coder. I will still be doing some billing and coding. It's just mostly going to be education, and then probably taking some like contract work to do some projects on auditing and projects for people. So I'll be doing more of the courses, more of the webinars, more YouTube content, more TikTok contact. Hey there, Lady C. Welcome to the chat. Glad to see you here, as well as social media outlets. So I'm just really going to be excited about all of the great content that I'm going to put out for you guys in 2021. I've had some questions about my CPC prep class, for example, that I'm still working out a few legalities. The AMA is very particular about their licensing and their copyrights for the CPT book, and I just want to make sure that I'm not stepping out of line with anything I want to do in order to give you guys the best preparation I can for the CPC exam. And I definitely want to, just be mindful of things. And if I have to pay them licensing fees to give you guys a superior product for the CPC exam stuff, that's something that I'm just going to have to do. Hey, Marissa, I am so glad that you made it. Hello, Lori Hunter. Hello, Amanda Alley, Paula Neary. I'm so glad to see you guys here. This is awesome. So yeah, I'm going to be doing a lot more of that content. And like I said, not giving up coding itself or auditing itself, just probably doing more contractual stuff. And I'm also in talks with an organization that actually wants me to teach their billing coding prep course, kind of an on-demand thing to prepare for them. So there's a lot going on right now. And I have some other offerings that I'm really, really excited to put together in 2021, especially because, I think there's some... how do I say this? I think there's some solutions that I have that will better improve, I think, career building stuff for coders that I can put together to kind of unlock all the secrets of how I've gotten to where I am in my career, and how I can teach you all to get to the same point, or at least elevate yourself from where you are. So let's get though into today's Q&A. So really, really excited for you guys. If you have questions, drop them in the chat. I'm going to try, I have my eyes on the chat right now, but I also have a lot of questions that have come through just through Instagram, through YouTube, through emails, and I'm going to go through as much as I can today. I'm hoping to be done by 3 o'clock, so I don't know, we'll see. Hey, Adrienne. So Adriana, I see in the comments, she says, I've watched most of your videos and am thinking about going to school for medical coding. Yeah. So what I always suggest is start with your local stuff. Do you have a community college? A lot of them have the Ed2Go program. I've heard that that's okay. You know, live instructors are best, but you might be able to get a very good financial aid through your community college, which means that you maybe will pay a lower price or get, you know, certain funding for that. And then if you need to go and get live tutoring or something, you can go to tutors.com. You can go to wyzant.com, which is wyzant.com. And they do have tutors available if you need someone to do one-on-one, but you'll at least get in there at a lower cost to start out. You could also check, there's just so many great options. I have a partnership with onlinedegree.com. So basically what they do is all of the questions that I typically ask people, like where are you located, how much are you looking to spend, how much time involvement do you have, they have formulated that into a question, and it's, if you go to onlinedegree.com/contempo, CONTEMPO, it will take you to that quiz, and they will basically pair you up with a really good billing coding school. And because I'm sending them viewers, I will disclose they will give you 10% off. Will disclose that I get a commission off of that as well. But again, I've partnered with them, so they'll basically feed you through to the right school, just like I would have. I just don't have time to look intimately into, you know, every single different school in there, but I do have some questions too as well as far as that. What would you recommend going into school or studying for the CPC exam on your own? There are definitely tools to study on your own. If you check in my channel, I have a self-study video where I basically tell you, like, the best books you can get are the step-by-step medical coding books by Elsevier. They're published by Bucks, and they are really, really good. So if you want to self-study, there are options to do that. Just understand that self-study sometimes, you know, there isn't a significant discount for doing that, but if you are extremely motivated, you know, you can self-study. There are options to do that, but you have to be very regimented, very self-motivated, you know, set yourself goals like, I want to complete chapters 1 through 3 this week, and then, you know, 4 through 6 next week. And there's a lot of options. Definitely check that video out. The other thing is, you know, you still have a lot of expenses, so self-study doesn't always necessarily mean free, because you still have to pay for code books. So between your CPT, your HCPCS, your ICD-10, that's going to be about $300. You know, to buy a textbook to learn how to code and a workbook, that's probably going to be another $150. Your exam fee to sit for your CPC, I think, is $350 just to sit for it. Sometimes you can find your local chapters will have review classes. They are sometimes more budget friendly. I have one that you can get online. It's $19.99 as well, if that's something you're interested in, and it comes with a practice exam. But your local chapters too sometimes have them, that they will even host them for free depending on the chapter, that you can get in on those. And they're breaking them down now often into Zoom classes where it's like a 4-hour Saturday, 4-hour Sunday. And that's actually something I'm probably going to be doing with my CRC course. I used to hold live boot camps that were basically for people who are already in medical coding and just want to get that CRC risk adjustment certification. And it would eliminate essentially the med term. It would eliminate the, you know, basics of ICD-10, the basics of insurance, the stuff you already know as a coder, but you're just want to get that risk adjustment credential, and just narrow down. So that's something I'm also thinking about doing in the future, is having a, like, you know, 4-hour Saturday, 4-hour Sunday Zoom camp where we can just, you know, speed you up to get your CRC credential and also give you online access to the materials as well. So that's kind of where I am at, you know, going to school. I think, you know, best situation is you want to go to school. I would look at accredited programs, ones that say that they're preparing you for the CPC exam. You don't want to get, nothing against the NHA, but I'm seeing a lot of people saying that they go to get their, what is it, the credential that they have, the Certified Billing and Coding Specialist credential. Nothing against that credential. It's just not super desired by employers. So the best, widest net that you're going to cast is if you get your CPC credential, because that's the most widely demanded one. Let's see what else I have in the chat here. I saw some other stuff coming in. I love your videos. I got certified about 3 weeks ago and I am having trouble getting a job. I know it's extra hard now with COVID, but how can I get my foot in the door? Do I follow up on apps? So yeah, it is extra hard right now with COVID. One of the tools that I have right now is if you check my video out that I have on alternative jobs for medical coders, that is the one where I break down all the stuff that will help you getting your foot in the door, like getting a job in scheduling, charge entry. You could get a job in billing. I actually, when I started out in charge entry. So I basically had the super bills over here on a display screen and then my practice management system on another screen. And I would read the super bills and just type in like 99213s and ICD-9 codes because it was, 12 years ago when we used ICD-9 then. And that's what I would do all day. I would just put in the super bills and type them all out and send them out the door to insurance. So that's how I got my foot in the door. I then transitioned to accounts receivable for a short period of time, and it was probably 1 to 2 years before I was actually titled a coder. Even though I had my CPC for a while, it does sometimes, you have to get that foot in the door job. The other suggestion I can tell you guys is one of the biggest things you can do is get on codersdirect.com. And they have a lot of different listings that you can slide myself back over here. They have a lot of listings of jobs just for medical coders. Some of them do require years of experience, but you can search it down if you're looking specifically for a location or if you just want to go remote. There is an option here to select remote. And you can search for specifically your credential. Maybe if you're looking for people that take CPCAs, those are where you can find that if you're looking for something remote that allows CPCAs, that is where you can find those types of jobs. And it looks like they do have some stuff here. You'll see a lot of stuff that's HCC coders, like right now, Weller Healthcare IT. If I remember looking at this earlier, they're looking for 100 risk adjustment coders, full-time, part-time, remote. Sometimes they are contractual, and depending on what your situation is, that might be good. If you have a spouse or something that you're on their insurance, you can take that benefit. A lot of times those contract positions pay you higher because they don't give you benefits, but if you're on someone else's benefits, it's not as much of a concern. If you're single, sometimes you can get more affordable health insurance through the ACA just as one person. Like I looked into it for myself and my daughter to ensure the two of us was expensive, but just to insure me was actually not too bad. So those are some good resources you can use to get your foot in the door. And again, check that video out that I have of those alternative job suggestions. What else do we have here? I've been applying to, so data entry. Definitely apply for data entry, patient account rep. The other suggestion I can do is if there's particular organizations near you, like I'm near Tower Health, I'm near Penn State Health. So if I want, sometimes they have a lot of people that apply directly to those websites. So they oftentimes don't post things a lot online. They aren't going to post in the newspaper anymore. They're not going to post too much online because people are going right to their website. So go directly to the websites of organizations near you. If you have billing organizations or hospitals or something, go directly to their website and check those out too, because oftentimes they don't promote too much because they just have so many people that are trying to get into healthcare right now. I've actually interestingly seen a big turn recently of LPNs that are trying to get into medical coding. I think especially with the situation of COVID, that they are looking at getting out of some of those clinical situations that they've been in and looking to get more of that remote work. So I am seeing a lot more people that are LPNs, even some medical assistants and things that now are trying to make that transition into medical coding. Are there a lot of trick questions on the CPC exam, and will they tell you how many codes each question requires? So that is a good question. There aren't a lot of, I would call them trick questions. There are some process of elimination techniques that you can use. A lot of times there's 2 questions that you look at right away and you can kind of go, yeah, that doesn't need that modifier. So it's definitely not D. And I know that they say that this patient doesn't have this condition anymore, and it looks like they code it, so that one's out of elimination right away. So I wouldn't say that they are trick questions, but the questions that they ask you on the CPC exam are really going to test your knowledge of the coding guidelines, because there might be answer A and answer B might be identical aside from the situation that two codes are swapped. So they might want you to know that if a patient has acute kidney disease and chronic kidney disease, that the sequencing guidelines say that the acute condition gets coded first and the chronic condition gets coded secondary. So you have to pay very close attention to make sure that you're selecting the one that has the acute kidney disease first and chronic kidney disease second, because you know those sequencing guidelines. But they do not tell you exactly how many codes it's going to require, but it is multiple choice. You get four options, A, B, C, D for each one. Let's see. Why is it so hard for those with no experience to land a job despite being certified? So that is a good question as well. The biggest thing is really liability. So there have been a lot of fly-by-night medical coding education institutions, academies, schools, whatever you want to call them, popping up, that instead of actually training you to be super efficient at your job, they're just training you to pass the certification exam. Is that a super chat? Oh my God, Marissa, thank you for upgrading to platinum membership. Congratulations, Marissa. So what happens is, they have maybe this 2-day boot camp and they're like, yeah, give me $2,000 and I'll train you to be a CPC and you can work from home. You go through that course and really what they've trained you to do is just pass the CPC exam. So I think more employers are noticing that they're giving people pre-employment exams and they're not passing them because they've only been trained to pass this multiple choice CPC exam. And they are not willing to take that risk that, they're going to hand over all their bills and their codes, their charts to someone, and they're not going to do them correctly. They could lose reimbursement. So it's not anything against the certification or the new coders. It's just that there's that liability there that they want to make sure that they're being very cautious about making sure that they're doing their due diligence, that they're hiring someone who actually knows how to code charts, who actually, is going to be very invested in what they're doing, that they want to make sure that that provider gets all the reimbursement that they're entitled to, that everything is compliant, that everything is accurate, and not that they're just someone who, I just, took this course because I just want to work from home and get a medical coding job. They want to kind of filter those people out. So it's just that they're very cautious about selecting people. One of the recommendations I can give you is get in touch with recruiters, because if you can connect with recruiters on LinkedIn and get that relationship going with them, that will oftentimes, they can pre-screen you and they can test you and know ahead of time that you're a good candidate, and that helps kind of move you forward then. What are some additional certifications you'd recommend getting? Okay, so here's my recommendation. If you're starting out and you're not in healthcare yet, I would recommend getting your CPC and your CPB, because then if you can't get a coding job, you can get a billing job and you'll get a better foot in the door, because you are going to cast that net across almost the entire rev cycle. Like, hey, I know insurance, I know coding, I know everything. So I can do a lot of different stuff in the revenue cycle or the billing office. If you're already a CPC and you've been a CPC for a little while, or you don't really want to get into billing, CRC, the risk adjustment, is like so incredibly big right now. Like I said, that position at Weller Healthcare IT, did I see it? Let me see if it's here. Yeah, let me switch over here. So it says here they are hiring 100 coders for this project. So I see this a lot. I see this a lot with these HCC and risk adjustment positions, that they're hiring not just 2 or 3 coders. They're like, we have a huge project and we need a ton of coders. So they're hiring 50, 60, 100 coders at a time. So that is something that I definitely think is on the rise, particularly with the transitions that we've been making in healthcare, where we're switching from fee for service into value-based care. So fee for service is you go to their doctor, you get billed a 99213, that doctor gets $150, whether they do a good job, poor job, doesn't matter. It's their set fee and they get $150. Risk adjustment is more like, oh, you go to your doctor, they did a really good job, your diabetes is in check, you've got all these chronic conditions that even though they're complicated, they're managing them really well. So that provider actually gets like a bump in pay. And providers are seeing that now. They're seeing that contractually. They're getting paid more from like a high mark, that they're getting like a 10% because they're doing good, that they've said, hey, we have these patients that have, end stage renal disease and cancer and all these complicated conditions, and we're managing them super, super well and keeping costs down. And they know now that they're getting all these incentives and they don't want to miss out on those incentives. So now providers are starting to hire more risk adjustment coders in the provider setting because they want that feedback, like, hey, you missed this on the chart, hey, you missed that on the chart, and because they know that that's going to help move those bonuses that they're getting from that value-based care. So risk adjustment is a big one right now. So I think that CRC certification is great. Keep an eye out right now too, because it's the end of the year and oftentimes the AAPC will have end of year blowouts on their study guides. So if you're looking for another credential, you can get them sometimes for like half price. And I actually went through my CPC and my CRC study guides from 2020 to 2021. And like the changes, I can tell you, are probably like 3% of the content changes. And most of it is just because of the code updates. So if you know the code updates, they really don't want to have to update these stuff as much as possible. Like it's a pain. They're not going to rewrite the whole book. So they only change the little bit that they have to. So I'm telling you, like 3%, 4% is all that changes maybe from year to year. So you can still use that study guide, but just know that there's been some code updates maybe from the previous year study guide. The other tip I can give you that reminds me is, so the AAPC oftentimes will run specials, and they had one just this month where you could buy, if you were already certified with the AAPC, you could buy an extra credential for half price. And you have to be careful with that, because if you go to buy it online, they will make you schedule, because they don't offer vouchers anymore, but you can actually call the AAPC and get an exam voucher, which means that you have a year from the purchase of that voucher to schedule. So I actually purchased my CPB the last time they have one because I want to get that credential too, but now I have a year from the time that I purchased that voucher to schedule the exam. So I don't have to worry about scheduling it for, up to a year from now. So that's something to look out for when they have those special deals. What was next? So, oh yeah, Senos mentioning that my course, that you also get 8 CEUs. Yeah, so that's a good course to get because you get 8 CEUs. Someone says, yeah, the AAPC Facebook group posts all the time from people saying they can't get a job. It's really hard right now. So yeah, it is. I think there's going to be a big uptick though. My prediction is that 2021, there is a huge... There's that huge E&M change. So my thought process is there's going to be a lot of audit activity for the office outpatient E&M codes 99201 through 99215 for 2021. So I foresee that there's going to be a ton of auditing or E&M coding positions specifically for those code changes in E&M starting in 2021, because I know that, CMS, Highmark, all the insurances are going to probably be ticking up their audit activity to make sure the providers are being compliant with those guide changes. Erica asked, do coders get paid by the hour or by the chart? It really depends on your employers. Some of them do pay you per hour. They might pay you $13, $14 an hour to start out. As you grow and get more experience, you can get a lot more pay in medical coding. And it also depends on your area. A coder in San Francisco is going to get paid a lot more than a coder who's in just a tiny small town in Montana. But there are ones that pay by the chart, which is great. If you have a little chart, if you have a big fat chart that you're coding, then you might be having to make some sacrifices there because it's going to take a lot more time to code by the chart. I've only done hourly positions or positions where I'm paid per hour versus by the chart. But I've heard that there are some coders that they're very productive, that they put on their headphones and they get in the zone and they can make buku bucks in code by the chart positions. Um, So yeah, so there's comments about there's not a lot of other positions where you have to get a certification and then you're asked to start somewhere else. And just kind of going back to my initial conversation, the other thing you have to think about is, medical coding's not as regimented as some other things. Like if you go to practical nursing school, you have gone through clinicals, you've gone through certain criteria by the state. Like there is very regimented testing because of that. And medical coding isn't that regimented. The state doesn't go, you have to do, code so many charts and get so much accuracy. So, again, it's just that liability. If it were to get that regimented and it was like a state exam, there'd probably be a lot less people getting into medical coding because it wouldn't be quite as easy to get maybe that certification. Not saying that it's easy, but there's just a lot of, I guess, hype around it. Aimster says, Victoria, I love your E&M series, but I'm still struggling a bit. I'd like to take your E&M course. How long on average does it take to go through the course? Like, could I get through it in a weekend? Yeah, absolutely, you could get through it in a weekend. So the E&M course that I offer is more so about leveling your service. So picking out, like, how do you get to a expanded problem-focused history? How do you get to a detailed exam? Those types of things. And then picking out the level based off of that. And then also talks about the updates for 2021. So there's information in there. So yeah, it's definitely something that you could run through in a weekend. And we actually have some cases that we go through in the end, so I can kind of show you hand by hand, like word as we're going through, like what I'm pulling out, what I'm kind of questioning. If you've seen some of my case examples that I've gone through recently, it's kind of in that similar degree where we're actually looking at a office visit and abstracting information from it, figuring out where's our history, where's our exam, where's our medical decision making, and then for the 2021 ones, just where's our medical decision making. I'm seeing some questions about what is a day-to-day like for a medical coder. So that depends if you're working in the office. Let me think about my last office job that I had where I was doing coding. So a common day for a medical coder is, it starts out like a typical office day in the office setting. So you get in, you kind of get settled at your computer, you log in, you clock in. First thing, you usually check your email, make sure that you don't have anything that's like pressing, like your boss doesn't say, hey, you have some, required training that you need to do, that your boss isn't asking you that there's something urgent. There's usually regular kind of emails that you might get, like, hey, it's flu shot season, or if you're subscribed to alerts from Medicare or Highmark, those will be in your inbox. Usually what you do is kind of prioritize your day. Most coders will have some sort of work queue that they might work through, that they'll just be like, here's all the patients that you need to bill for the services for Dr. X for, and you go in and you go into the queue and just start coding things. Sometimes you'll run a report for Dr. X for all of his surgeries for the past, couple of days, go through that report and start coding based off of what's on the report. Sometimes someone will email you the report and say, here's all the cards that Dr. so-and-so submitted for his surgeries this week, and you just code them out. You'll get your code books, you'll sit there, you'll code them out. Oftentimes in the office setting, depending on what you're doing, you might be printing them and then writing them on and then submitting them in the practice management system, sending them out to billing. Sometimes, depending on the setting, they'll send them back to you. Like if something hits a edit before it goes out the door that says, hey, you put on the wrong diagnosis code, or hey, this isn't a paid diagnosis code, someone from billing might kick it back to you and go, hey, this isn't gonna get paid, or you put on the wrong diagnosis for that Highmark doesn't take. Are you sure there's not another diagnosis you can look at? And then you'll look at it and go, well, this is the diagnosis that the provider documented, and I'm sorry it's not on the insurance's acceptable list, but that's what the patient has. So there might be some of that back and forth that they're kind of almost questioning, like, is there another diagnosis? Did you code this correctly? And you're like, yeah, I coded it correctly. But and then sometimes, you know, you'll have periodic audits that someone in the auditing department might look at a handful of your charts every month or every quarter, or there might be your supervisor looking at them and having those conversations about, hey, you know, I looked at your charts, you're doing good, or your accuracy's only at 90%, and here's where you hiccuped a little bit, and that's where we want you to improve upon. You know, you missed that the signature was missing or something like that. And a typical remote day, I'm going to tell you, like my remote days, I basically roll out of bed 5 minutes before I log in. And then I log in, again, check my email, see if there's anything really pressing that I need to take care of. And then as an auditor, I would log, I have reports that I run where I pick random samples of cases out of like a 3-month span, audit the provider, see what was on the CMS 1500 form. Let me see if I have one here to kind of show you. I don't have one handy. But yeah, I look at the actual CMS 1500 form, what was billed out to the insurance, and see if what I'm auditing matches up. I look at the documentation, say, hey, you know, oh, we billed out a 99214, but this patient didn't have their past family social history documented, or it was billed under the wrong provider. Give all that feedback, formulate my report, send it out. That's what I do in an auditing position remotely. Remote coders, again, it's just a lot of the same stuff, working through either work queues or reports, you know, however they get their, you know, sometimes providers sometimes still use those surgical cards or spreadsheets, and they send those over to the coders to work. And you have your typical office feedback, you know, emails from your boss and all kinds of stuff. Lily C says, I want to get into the billing side of coding. What types of jobs should I work for? Accounts receivable representative, insurance verification. You could also go on to, like I said, codersdirect.com, and they have a box here if you're looking for billing jobs. I think there is a section for, like, if you would look maybe for jobs under the CPB, because that would be the billing credential, and they might not necessarily require the CPB, but it might be something that will give you a billing. Or let's see if they have a search. I don't know if they have a search, but for billing. Yeah. But yeah, accounts receivable, patient insurance verification would be another one. Payment posting, billing clerk, billing specialist. Those are the types of positions I would look for. What you could do is just, if you go into like I think Indeed.com, and you're searching for positions, just search for the word medical billing, medical biller, CPB, billing specialist, and see what you can find under those key terms. It's better you use a smaller kind of key term and search that way versus looking for a longer position like accounts receivable specialist, because you might get a ton more stuff or for accounts receivable. Or like I would just keep it to like medical billing, biller, because you want to keep it very targeted versus getting too much or also getting too narrowed down. Is any laptop good for medical coding? So a lot of times your employers, when they hire you, if you're working remote or in the office, they'll supply that for you. As far as any laptops that are particularly good, you know, I personally think Chromebooks are fine. I don't think anything that you're going to have to toggle is too intense. You may have maybe 3 or 4 different programs open at a time, but it's not like you're doing gaming or video editing or anything on it where you need something super, super high tech. I've seen some things though recently with the AAPC where they've said not to use a Chromebook for their online CPC exam. I really don't understand what the rationale for that is. But I would say that anything that's just your middle of the road laptops are probably going to be fine. So what else? Oh, the Real VB says she just passed her second cert in the COC. Congratulations. I just took that one recently. It was something else. Holy crow. I think I would have rather taken the CPC exam 4 more times than take that COC exam again. I don't know what it was about that, but I just could not get the time correct. Like I was doing real good until I got down to those long cases, and then I was just like, holy crow. What is the membership perks for joining the channel? So we have 3 different membership tiers. We have silver, gold, and platinum. All of those membership tiers, you get access to community-only membership posts. You get any free CEU courses that I offer to my members only. I think I have 2 right now up, and there's going to be a 3rd, which is the ICD-10-CM guidelines videos that I made. I'm going to convert that into a course that I believe should get approved for 5 CEUs. So that'll be good. At the gold and platinum membership, you actually get your name added to the end credits of the video. So if you've ever seen those go by where it says, thank you members, you get your name listed there. At platinum level, you get outtakes. So I post like monthly blooper reels and outtakes and behind the scenes stuff in the community only posts. So that's what you get as your membership benefits. And I think there is more membership information that it'll give you if you hit the join button. But yeah, you don't have to join paid membership. I'm still here for you guys all the time, giving out free information. It's just that the paid members do get extra perks. Just took my exam November 14th and rescheduled for an exam in March. Do I need to study for the updated information? Yes. So they do update the exams. All the exams get updated January 1st is when they start spitting out the exams for the new year. Like I kind of said before, though, the AAPC, I mean, if you think about it, would you want to have to update an entire huge course like every single year? No. So they're just going to take those little segments that updated and update those. If they have something maybe that was a deleted code, they might actually just pull that whole question out of the pool instead of having to formulate a new question. So, while there are changes, it's not like they're looking to intentionally go, oh, there's a new, chronic kidney disease, stage 3A and 3B this year. We better make a new question about that and put that right on the exam for everyone. They want to make it easy for themselves so that they don't have to do tons of updates every year. So while they do update, it's not like they're targeting to put all of the new questions into the CPC exam, but there will be a percentage though of updates, but it's not going to be it's not like they're going to just test you on all of the new stuff. Like I said, I've looked through the study guides and stuff that's been updated from the past year, and we're talking like maybe 3 to 5% of new material. I have 2020 books, but I'm not going to sit for the exam. Should I get new books? So in 2021, you can still sit for the exam with your 2020 books. Obviously, if you get questions though, that will be stuff that's new, you'll be at a little bit of a disadvantage because your books aren't going to have that updated information. Like I just said, the chronic kidney disease 3A and 3B is new for 2021 instead of just 3. So if you were to look in your book and they asked you a question on that, you would be like, what the heck's going on? Why do I need these extra character extensions? Because that's not going to be in your 2020 book. How much risk are you willing to take that 5% of code updates is within your version of the CPC exam? That's kind of up to you. Obviously, the better preference would be to get new books, but understand that that's also not an affordable option for everyone, and also that some people are like, I would rather take the risk that I might have a new code question versus having to take that time to re-highlight and re-tab and redo everything into a new book. Give my thoughts on Practicode. So I have not myself gone through Practicode. So here's my thoughts on Practicode. Is it going to count as experience in the eye of an employer? No. Is it going to possibly get you through the door because there's some positions where they say no CPCAs? Yes. So it will get you definitely ahead. I've heard it's very difficult. I've heard a lot of people say that they, don't that they've basically loaded up the Practicode and were like, oh my God, I feel like I don't know anything. So it is pretty intense, but I think it will give you an advantage over the positions that are like, hey, I have the positions that are just saying like, we don't want CPCAs. So you will be able to apply for that because if you get that Practicode and that other requirements met and you can get that apprenticeship removal required, that's obviously a benefit. But it isn't going to count quite as experience in the eyes of an employer. So if they say they still want 2 years experience, they might not always count that in particular. The other thing I will say though is, I've heard a lot of different opinions from people saying, hey, you should just apply anyway. And yes, you should. They might look at you and go, oh my gosh, this person is culturally the best fit for us. But it really depends on what that screening process is like, because there are a lot of, especially in larger institutions, if they will go through almost a filter with human resources. And if you don't meet the certain criteria, they won't even pass your resume on to the person who's hiring for the position. Brenda says, why don't you give us some scenarios to work out on our own once a week? That's not a bad idea. That's something I can potentially look into doing, to work out on your own. I just have to be very careful because I don't like to take too much of other people's materials. Like, I have stuff from the AAPC, but it's their licensed materials. They own the rights to it. So they've said, like, you can share a little bit, but not a lot. I do have some scenarios that I go through with case examples. So what you can do is, if you want to read through the case examples that I'm giving, you can pause the video there, work through it yourself, and then see if you match up as I'm going through it. What is an HCC coder? HCC, hierarchical conditional categories. So that's risk adjustment coding. It just codes ICD-10 So you're just working with that one code set, and it's risk adjustment coding. So just coding for diagnoses. Can an RHIT be a regular coder, or do they have to be supervisory? So, I've seen a lot of people get their RHITs to get into medical coding, and I've noticed a large trend of RHITs saying that employers are coming back at them and saying that they don't really consider that a coding credential, that it's really health information, and they still want those RHITs to get either their CCS, CCA, CCSP, CPC, some sort of additional coding credential. I've seen a lot of RHITs that, yeah, they do just work as regular coders, but they do have an additional coding credential. Is there a surgical medical dictionary? There is I've recently come across, and let me see if I can even find it for you guys on Amazon. There isn't a surgical medical dictionary, but there is a medical terminology and anatomy book for medical coders. Let me see if I can find it for you guys. And I have seen a lot of instructors that are giving specifically this book lately. Medical coding, medical terminology and anatomy, 3rd edition. Where is it? Yeah, so MedTerm and Anatomy for medical coders. This one I've heard really, really good things about, and that's another Elsevier product. So that's by the same people who do the step-by-step medical coding books. And this one I've heard is fantastic. That one is very specifically geared towards people who do medical billing and medical coding. So that's one I would recommend. I've heard really, really good things about it. But as far as just surgical medical dictionaries, there are specialty coding books you can get. They won't be beneficial to you, though, if you have an encoder program that gives you all the lay descriptions and diagrams and stuff, like a Codify, or like, well, I guess Supercoder now is Codify, but something similar to that, because essentially some of those specialty coding books for like urology coding or plastic surgery or general surgery, it's the same information in those books that you would find through those search tools, those encoders that you would have. Someone's asking, what is Practicode? Practicode is they're redacted medical cases, so medical cases that they've scrubbed the patient information off of, and they will allow you to go through these modules and code them. And when you complete the Practicode, it will take 1 year off of your 2-year apprenticeship removal. So if you go through 88 contact hours through a accredited program or program that the AAPC accepts, and then you go through Practicode, you can, instead of getting 2 years experience, you can go through those and get your apprenticeship status removal taken care of. So that's what Practicode is. They're practical coding cases. How do I become organized when studying ICD-10, CM, and CPT? Organized, my gosh, organization is not always my biggest strong suit. You guys don't see this, but oftentimes before I record my videos, my office is a bit of a mess, and I essentially just sweep everything off of it and put it onto the floor so that it's off screen and you don't see it. And then I put it right back when I'm done recording. Tabbing is great. You can also check if you're looking for organization as far as how to do your books. There's 2 strategies that get used sometimes by people who like the highlighting and underlining stuff. There's the BAT technique, BHAT, which is exclusive to CCO. They actually own all the copyrights and trademarks for that. And they will walk you through what to bubble, what to highlight, what to underline. You know, the issue is the AMA doesn't really like you showing their entire CPT book and going, here's what I underlined, because that's the entirety of their book. So I think the guidelines were updated that now they're like, look in the upper left-hand corner and circle this word and underline this word, because they can't show you essentially the whole book. And then there's CHUN, CHUN. I think you can search for either of those on YouTube, and there might be some demonstrations of how to do that. But I like the guidelines. The guidelines are really your gold in ICD-10-CM, and as much of a pain as it is to kind of read through them, and they are kind of dry, that is really your key. And with CPT, it really is just training yourself to understand where those key terms are, where you're following up on the parent codes. And that just takes a lot of practice. It really does. And, you know, the nice things that I like about the bubbling and highlighting and underlining type of techniques are they're very good for your coding exam. I personally, as someone who's coded for years though, I don't want to invest 20 hours underlining and notating my book every single year. So your best bet is really to just get familiar with your book and what you need to abstract, and try to just write the notes as minimally as you can going forward. Because to highlight your entire book, like, your employer's not going to want to pay you hourly for 20 hours to sit and highlight every single key term and stuff in your book every single year. Paula Neary says, thank you for doing this, Victoria. This is very helpful. You are so welcome, Paula. Let's see. Do you think studying 8 hours a day is too much? I mean, that really depends on what you have going on. If you're someone who's single and you have no kids, yeah, I would say go ahead, study 8 hours a day. I personally, that would be too much for me. I would probably, in that 8 hour block, wind up spending a lot of time, you know, looking at TikTok and other things, because I'm easily distracted. Excuse me one second. If it was my ideal is, I would say maybe 2 or 3 hours a day if you really want to go hardcore at it, and take breaks in between. Can you use medical dictionaries on the exam? So no, you actually can't use medical dictionaries for any of the, well, actually I shouldn't say that. You can use them for some of the AAPC exams, but for the CPC exam with the AAPC, you're not allowed to use it. There are certain ones. There's criteria. Let me see if I can find that for you guys too. Exam FAQs. So if you go on the AAPC website, I think it's right here, Medical Billing and Certification Exam FAQs, there is a tab here that says what is allowed in our books. I know there's a section in here somewhere. Where is it? Where it says about what can I bring to my, how many times can I take my exam? How do I cancel the exam? What is allowed in our books? No materials other than tabs. What year's books? Oh, what items will I need to bring to the exam? So here it is. So for a complete list of approved and recommended resources, it says to refer to the approved resources document. So if you look at that, it will tell you what certifications you're allowed to bring the medical dictionary to. So if we look over here, it says CPT, your choice of ICD-10-CM, HCPCS, E&M audit sheet, ASA, CPT crosswalk, anatomical charts, both volumes of Coding Companion. Oh, here we go. So anything that has a 10, it says one reference of your choice. This does allow a medical dictionary. So that means you can only bring it for these certifications that have the 10 on them. So any of these, you can bring a medical dictionary as your reference, but you are not allowed to have them for the CPC exam. Because if you scroll up here to our core credentials, it looks like the only core credential here that you can have a medical terminology book with is the Certified Documentation Expert Outpatient. That's the only one that you're allowed to bring a medical med term book with. And that's, I'm not even getting to my list of questions that I have. Oh my gosh. I spent like an hour getting all of these together and then couldn't do anything with them. So someone did ask me recently about medical terminology, and it was Travis, and he says, this is a dumb question about learning medical terms since we can find the definition of terms so easily with our smartphones. Does knowing what it means already save a lot of time over the day, I'm guessing? I'm just curious. I can talk a word into my phone and the definition comes up, wondering why we need to know all the terms. Totally new to this. Thanks. So, medical coding is a healthcare position. And when you're invested in a healthcare position, you have to know the lingo a bit. So, yeah, you can search for something pretty easily. In the CPC exam, though, like I said, you're not allowed to have those medical dictionaries for your exam because they want to really test your medical knowledge. They want to test your medical understanding. So there's a lot of ways you can search med terms when you are actively coding in a position. It's going to slow you down though. And medical coding is oftentimes a productivity based position. So they want you to get the charts done accurately, but also quickly. So, you might not think it's going to take much time to look up one or two medical terms, but, if you're doing that 20 times a day, that is going to slow down your productivity. You also want to be able to speak authoritatively when you're talking to doctors, physicians, nurses, practice managers. It just really makes things a lot easier when you're working your way through, especially surgical coding can get pretty complicated. And yeah, there's going to be a lot of stuff that you're going to look at for a period of time. But as you get more familiar, then you can build up speed, and then you can kind of register, if you're coding for a specific specialty like orthopedics, then you're going to start getting more familiar with those orthopedic terms because you're usually coders tend to be targeted towards one specialty. It's kind of like if you even think of nursing, you can't just take someone who's been a pediatric nurse for 6 years and then stick them in the OR doing neurosurgery. I mean, you can because they are a nurse, but are they going to be adept at doing neurosurgery right away? Probably not so much. Same thing with medical coders. So we tend to specialize in a few things, and then we're really good at learning that specialty. Not saying you can't learn other stuff, but it's better to target a few things versus just doing everything across the board. So what else have we got here? Yeah, someone else says the bubbling and highlighting thing is time consuming, but it is very, very good for your exams. I just don't think it's something that you necessarily need to do every single year, especially if you're, again, a specialty coder. If you're just coding neurosurgery and you're only working with a handful of codes, do you really need to highlight and notate your entire CPT book every single year? Probably not. But when you're taking your exam, yeah, it's a great technique to help draw your attention to certain things so that you can get through those questions faster. Someone says, in my area, Maine, there are opportunities, but these positions require medical coders to cover the medical billing as well. Does this require separate certifications? Not necessarily. It really depends on what that job description says, if they require 2 different certifications. Oftentimes, if you go to a school, they will train you in billing and coding. Like my local community college trained me as a medical billing specialist, actually. And then I went on to get my coding certification through an independent instructor that was having a course. But a lot of these diploma programs, degree programs, associate's degree programs, and even like the 9-month, 6-month courses that you can get through the diploma programs through career schools, they will often do a billing and coding package deal. So a lot of times that training will get you through kind of everything. Although I'm aware it would be difficult, could I possibly go straight for my CRC and obtain my CPC later? If so, what's the best way I should go about that? So absolutely you can. There are some coders that I know that just have their CRC and that coding alone because they just want to do ICD-10-CM coding. It's going to limit you if you just have your CRC for a while because you can only go for risk adjustment positions. The best way to go about that is, I would say, if you're not in healthcare yet, you really, really do want to get medical terminology down. There's going to be pharmacology on there as well, and your anatomy and physiology, and a basic understanding too of insurance. So you need to know for your CRC what is a Medicare program and what is a Medicare Advantage program. So those programs that replace Medicare, like your Senior Blue, your Geisinger Gold, like those insurances where they can replace your Medicare, but also give you additional benefits, or you may have better prescription management and all that, the extra bonuses that you get by replacing your Medicare. So just having that understanding of those insurances, the med-term, that is really the focus, that you really need to have that good baseline knowledge before getting your CRC, because it's going to be a lot more than just diagnosis-based coding. It's going to be all that as well, and all the different programs and documentation and stuff too. So yeah, that is a good way sometimes to get in, especially with them hiring just so many risk adjustment coders in droves that they're hiring. Like I saw, like that position was 100 coders that they're looking for all at once to work on that project. Someone says, your sessions have been really helpful. Thank you so much. I apologize. I don't want to butcher your name. Amaniria? Okay. So Abby Hart, do you feel isolated being a stay-at-home coder? I'm kind of a homebody type of person. I don't feel isolated. I mean, I still have my boyfriend at home and my daughter, and they keep me very active. I also have a pit bull. His name is Loki. I adopted him actually right at the beginning of the pandemic. He's maybe getting close to a year old now. I don't feel isolated. You know, it really depends on what your support system looks like. If you have friends that you can talk to, if you have people that you communicate with, you know, churches or volunteer activities, those are important. There's definitely a lot of ways to not feel isolated when you're still working at home. And I know, like I said, I'm kind of a homebody. I had to laugh. So I don't remember who sent this to me, but someone was sending me, I don't remember if it was on Instagram or email. And they're like, oh, Victoria, you're so great. And you are literally goals. And as I'm reading it to my boyfriend on my phone as I'm like sitting on my beat up couch because my dog ate it when he was a puppy. And I'm eating like leftover spaghetti. And I'm like, I am definitely goals, like laying on my couch eating leftover spaghetti. But yeah, I'm not, my personality isn't that I want Lamborghinis or that I want to go to Spain. I have a semi-attached home that I love. It's next to a creek across from a field. My goals are just to pay my mortgage and maybe go to Disney once a year would be great. I think that is a reasonable goal to have. My goal in teaching medical coding and helping others is not to make everyone rich and famous and wonderful, but I want people to have time to go to their kids' sporting events, and I want people to be in a situation where when something comes up that they need equipment for their kids for their sporting events, that they don't even have to worry about being able to afford it because they've got a solid position. That's what I want for people. Like I want everyone to have a comfortable lifestyle through medical coding where they can work from home and they have more time for their kids and doing all that kind of stuff, just to have a good life and better work-life balance. And that's what I like about it too, is just having that balance. So I don't feel isolated, but yeah. I'm kind of a homebody, but if you're more of an extrovert, you might have more trouble with that. What's the next best step after passing the CPC as additional certifications? So if you're having issues finding a job, I would go for the CPB, because then you can get into the revenue cycle billing department somewhere and move over to a coding position. If you are already in coding somewhere, I would definitely say go for your CRC, because there are just so many amazing risk adjustment positions right now that are opening up. So I can't believe how fast this hour went, you guys. It's already 3:00. I have 4 pages of questions that I didn't even get to, but I really truly hope that you guys got some great value out of this hour. I'm going to be doing a lot more of these in 2021 now that I'm going to be going full time with the business and the channel. So I'm hoping to provide just so much more value to you guys, tips on how to find those jobs, give more information, work you through some of the things, because I'm getting so much feedback from people who are taking courses online right now, and they're either on demand and they don't have interaction from their instructor, and they need someone to kind of walk them through just a little bit. So I'm going to be doing that that. I've also had some people reach out saying that they're looking for tutoring. That might be something that I'm going to offer in the future. So we'll see where that kind of lies. You know, the tutoring, you know, I am opening communities too on my website. So there's going to be probably more office hours starting in 2021 where anyone who's in any of my paid programs, I'm going to say, hey, like Wednesday at 7 p.m., log in. If you have questions, come and get me. So one last question I've got, what should I start to learn for a CPT or ICD-10 CM? So definitely start with diagnosis coding, because I think the diagnosis coding part is a little bit easier to grasp. And personally, it's my favorite part. I love the diagnosis coding. But yeah, thank you again so much. I'm going to have to wrap it up for today because my hour's already done. Check out the rest of the videos in the channel. I'll be back hopefully not too far in the future and doing a lot more of these. The merch store is open if you want to get the #MedicalCoder t-shirt just like me, or any of the other cool ones. I've just made up some just fun medical coding themed t-shirts and mugs and stuff that you can check out on the merch store. So it's linked directly now on the YouTube channel. Again, so incredibly grateful for you guys. I thank you so much for coming in today and spending some time with me, chatting about medical coding. And I appreciate that you weren't like, hey, do my homework for me. That's always the best too. Thank you guys so much. I will see you guys again soon. But for now, you guys,